Let's get started. Hi, everyone. My name is Cody Eckert. I'm the Director of Global Operations for MUN Impact. I hope you've been enjoying the Global Summit. This is sadly the last day and the last workshop session, so I hope you enjoy it and get as much out of it as you can. I'd like to introduce my friend and former colleague, Ms. Latisha Crawford. We worked together for a few years in Washington, D.C., and at a transit planning and consulting company. And before I started working there, I didn't know too much about transit and transit issues. And after working there, it made me realize how important and how essential they are to delivering services to people and making services accessible to people, in their communities. So in planning the summit, I reached out to Ms. Crawford, and she's graciously decided to present to us. So please welcome her and enjoy the workshop.
Thank you, Cody. Thank you for that introduction. Hello, everyone, and thank you all for joining this session titled Transportation and Healthcare Access in Rural Areas, Making It Happen. Let me begin this. So the purpose of this session is to highlight a growing and yet problematic trend happening across the United States. That is the closure of rural hospitals. And then I kind of want to talk about this trend in the broader context of transportation and healthcare access, especially in rural communities. But as Cody mentioned, my name is Latisha Crawford, and I'm a transportation planner for a global consultant firm that provides management and consultant services to the built and natural environment. So I get to work on various types of transportation and infrastructure related projects. I've been a transportation planner for about 7 years now, but my academic background is actually in international studies and economics. Though one of my areas of interest is in rural transportation planning, I can actually point to my childhood as when I first became interested in transportation and realized its importance in promoting healthcare access in rural communities. So originally I am from Eastern North Carolina, and for those of you who don't know, North Carolina is located here on the eastern coast of the United States. And both my maternal and paternal sides of the family are from very rural parts of the state. My grandparents on my mother's side of the family, they actually lived in a very small town. It's one of those one stoplight towns, very small, everyone knows everyone. But one of the things I remember the most about visiting my family sometimes was riding with my aunt to take my grandfather to his dialysis appointments. And for those of you who don't know, dialysis is a treatment that people with severe kidney disease undergo. So at the time, the closest medical facility that my grandfather could travel to for his dialysis treatments was about 40 miles away from where he lived. So my grandfather lived here in Dover, North Carolina, and he had to make the trip multiple times a week to go to Goldsboro, which is it's about 40 miles. Now, thankfully, between 14 aunts and uncles, there was always someone available with a car that could take my grandfather to his appointments or, help my grandparents run different errands. But imagine growing old somewhere in an isolated town. You don't have a car, you can no longer drive, or maybe you have a disability that prevents you from driving, and you don't have family that can take you to your doctor's appointments, and there's no public transportation available either. How do you meet your basic needs? That problem is the reality that many people face in rural communities. So at a young age, I began to think about these issues, and having those experiences visiting my family, along with a few others, inspired me to want to study transportation and healthcare. So I'm excited to be able to present to you all today on this topic that is not only personal to me, but also the 60 million Americans that live in rural communities throughout this country. And perhaps some of you all maybe be able to relate to some of these mobility challenges and may have similar experiences. So during this presentation, I challenge you all to think about the issue of transportation and access to healthcare and relate that to the Sustainability Development Goals, especially goals 3, 9, and 11. Good health and well-being, industry innovation and infrastructure, and sustainable cities and communities. But to kind of jump in and begin, a lot of research has been conducted on public transportation's role in promoting healthcare access, but often when we talk about these topics, they're discussed in an urban context. And that's generally because people rarely associate public transportation with rural communities because it's either non-existent or very limited. But the lack of public transportation and the recent closure of hospitals shines a light on the inequities that exist in rural communities. So to illustrate, I'd like to tell you all a story about a place in Beaufort County, North Carolina, which is located here, if you can see my pointer. Beaufort County is located on the Pamlico Sound of North Carolina's coastal plain region. It covers about 830 square miles, so geographically, it's a pretty large place. A little over 47,000 people live in this county, of which 19.2% live in poverty. But within this county is a small town called Belhaven. In 2014, the local hospital in this town closed, leaving residents without access to emergency and hospital services. So let's just take a closer look. I'm gonna show this video of this situation.
Action. Action.
Adam.
Sorry, hold on. Let me jump back. I apologize, one moment. Sorry, everyone. Could people hear the beginning of that video?
Yeah, we could.
Okay, great. Okay, here we go.
Action. Action.
Adam. Adam,
Action.
move your foot or I'll break it.
Well, go ahead and
Move
break it then. Action.
He is busy.
Action. Will you come here for a second when you get done?
Would you please move?
3, 2, 1. A rough start to tonight's meeting as dozens of people, including the mayor of Belhaven, the NAACP's Reverend William Barber, and the media, were closed out of Pantego Creek LLC's meeting regarding Vidant Pungo Hospital, a meeting that was set to decide if Vidant violated its agreement with Pantego Creek, therefore leading to a lawsuit.
They don't want people to see what they're doing in there. What the hell? I thought it was a public meeting. I mean, it's always been open. They've always had guests. And Ellen Allen standing at the door, you know, doing her thing.
The business that they'll be doing will impact the public, but the public will not be allowed to see them do their business. They've not asked to speak. The public is simply asked to be present.
You can't come in.
Why is that?
Because it's a membership meeting only. This is just for the membership of the Pantego Creek LLC. We will vote tonight. That's why it needs to be a controlled, restrained meeting.
The explanation that I received was in essence that this needed to be a controlled meeting, as though the public is out of control. They're not out of control. They are very much concerned about who will control their future and who will control their health care. They have a serious interest. This is not about mere dollars and cents. It's about life and death.
I was disappointed in the administrators that have made this decision. I was disappointed that they would leave this area of the county, as well as Hyde County, without emergency services. If we get right down to it, people will probably die if the hospital closes.
I cannot imagine our town and our people being very well taken care of medically if we do not have a facility that can do the essentials to diagnose and manage these patients. Modification of health care is appropriate, but not eradication of health care.
Here's Belhaven. The existing hospital is right here on the western shore of Wind's Gut. Here's the city of Washington, 30 miles by roads. From Belhaven to the main part of Hyde County, some 50 miles. That represents a long time because these roads are not good. Someone will have a serious injury in Hyde County, make it to Belhaven, and then transfer to the Belhaven ambulance to complete the journey to the Washington hospital. The problem is, if you have a serious wound and you're bleeding, then if you can't stop in Belhaven and you have to go all the way, you have added huge increment of time. The ones who had serious injuries would die before they were tended to.
When you take patient care out of the scenario, you take people out of the scenario, it becomes a business decision.
It makes me sick to even think about what Biden is trying to do to us. And I feel like we're being mistreated. I'm 77 years old. It makes me feel bad when I start even thinking about what they're doing.
Biden thinks that they can come into this little town in northeast North Carolina, this little coastal community, and take our health care and nobody say anything. Well, that's not the way it's going to be. If they were in good faith trying to do the best thing, they would be sharing their numbers with us with no reservation because there'd be nothing to hide. It would be like if you had a grocery store in Washington and one in Belhaven, and you knew that the people in Belhaven, if there was no grocery store, they had to go to Washington. Well, if you could get rid of the expense of having a grocery store in Belhaven and send all the customers to Washington, you'd make more money. The reason they're not sharing our numbers is because they're mixing in costs that aren't direct costs to our facility, and they're taking every worst case scenario possible to eliminate our hospital.
Wake Forest Baptist out in Winston-Salem was trying to do this, and there was a lawsuit over it. And the confidential business report actually spelled out, it said, we want to move the hospital because the population where the hospital is poor, largely African American, and uninsured. And we want to move it closer to Winston-Salem where people have insurance, and we want to move it to this Gulf community. And we thought this trend would stop with Medicaid expansion, and as you know, at least for this year, the General Assembly said we're not going to take Medicaid expansion. So we're going to still see this problem of hospitals wanting to relocate to areas where people are better insured.
They are after the dollar. That dollar is what they're after. It's not the people's lives. They really need to stop and think, because if they close this hospital, death is on their hands. It's by all these children around here. This hospital's got to stay here.
All right, here we go.
You're not coming in. You're not coming in.
Golly.
You said it right.
John, what's the deal?
Marion, Ari apparently has made a deal with these people so that the town is put the money in.
We do want the mayor and the town manager.
Ari apparently has made a deal with
All right. So I know there was a lot of things happening in this video, so let me try to sum it all up. This case, this hospital closure, Vidit Pungo Hospital, this actually made national headlines. This happened not too far from where I grew up. So to give you the backstory, Pungo District Hospital opened in 1948. It was initially operated by the Pungo District Hospital Corporation. However, over time, the hospital began to experience some financial struggles. So the board responsible for overseeing the hospital asked for a third party to come in and take over operations. So in 2011, a bigger corporation, Vidant Health, acquired the hospital, and the board responsible for overseeing the hospital restructured as Pantego Creek LLC, which you saw in a video, a representative of Pantego LLC. However, in 2013, Vidant Health claimed it was unable to keep the hospital in operation, again because of poor finances, and announced that it would soon close the hospital. So this video that you all just watched is that meeting where that decision is being made. As you can see, there was a lot of controversy surrounding the meeting. Many of the people and groups who opposed the hospital closure were not allowed to attend this meeting and voice their concerns. The NAACP, which is a civil rights organization here in the United States, along with the town of Belhaven, actually sued Vidant Health, claiming that the closure of this hospital discriminated against poor people and minorities. They ended up losing the lawsuit, and in 2014, Vidant Health closed, and then in 2016, the hospital was completely demolished. So I want to look a little bit deeper into the impact to the community that this hospital closure caused. So let's take a look here. In the video, you heard numerous people ask about the impact, or speak about the impact that the hospital closure would have on the residents in certain communities, such as the low income and minority populations. They also spoke about the longer distances residents would have to travel, the longer travel times, just to undergo medical care. So to explore some of those impacts, I have a map here I created based on a transit needs analysis I conducted on the area. But first, I just want to kind of go over a couple terms. First, transit-dependent populations. Transit-dependent populations are the segments of the population that don't have a personal vehicle, so they don't have a private car or anything. They don't have access to a personal vehicle, and they're unable to drive. So they rely primarily on public transportation to meet their mobility needs. Now, if you remember, I mentioned a little bit earlier, in rural communities, public transportation is often limited or it doesn't exist. So in conversations like this, we never really talk about the transit-dependent populations in rural communities. But those segments of the population are more than likely older adults, they're individuals with disabilities, they're low-income individuals, households that have no personal vehicle, youth population. And this isn't an extensive list, it's just some of those factors that contribute to transit dependency. But going back to this map, it shows the relative transit need in the area by measuring certain segments of the population that I just mentioned that are likely to be transit dependent. So the darker areas symbolizes more transit need. So this red dot here, that is where Vidant Pungo Hospital was located before it closed. This green dot symbolizes the closest hospital that's in operation. And this hospital was actually built in 2015, this one here in Washington. So this one wasn't always existing. But the difference between the location of where Vidant Pungo Hospital was previously located and where the closest hospital is 23 miles. So residents in the Belhaven area, which is located here, now have to travel 23 miles to the closest hospital. So this is about a 30 to 45 minute car ride one way. And as you heard in the video, depending on the severity of a person's condition, making that trip could be a matter of life or death. So let's take a look at the same trip from the perspective of a person that's dependent on public transportation. The transit-dependent population in this community is relying on they rely on Beaufort area transit system, which is the local rural transit provider in this community. Like many rural public transportation providers in the United States, Beaufort County area transit systems services are limited. The system only operates Monday through Friday. There's no bus routes or bus stops, so residents can't just walk up to the bus stop and catch the bus and, ride the route to the hospital. They actually have to call the transit agency and schedule a ride almost like you would a taxi, and then a van pretty much shows up. The problem with that type of transportation is that it's expensive and it's inconvenient. A study by the Federal Transit Administration found that the greatest problems of people using public transportation for healthcare trips in rural communities are the inconvenient schedules. So in our case, a 30 to 45-minute trip by car from Belhaven to the hospital in Washington could take about an hour and 30 minutes on the bus. So you all just saw a very specific example of what's happening in one community. But as I mentioned earlier, scenarios like this are happening all across the country. Since 2005, 170 rural hospitals have closed, contributing to the healthcare crisis in rural communities and exacerbating rural health disparities. These disparities can be attributed to differences in how we as a people experience the world. For instance, 20% of Americans live in rural areas, and by most measures, the health of those people are significantly worse than those living in metropolitan areas. In fact, the mortality rate for the 5 leading causes of death, heart disease, cancer, unintentional injury, and respiratory disease and stroke, is much higher in rural communities than urban ones, and that gap is growing. So why are these disparities happening in rural communities? Well, first, let's take a step back. Health and healthcare disparities refer to differences in health and healthcare between groups, and they are closely linked with social, economic, and environmental disadvantages. Health and well-being are closely linked to the social and economic conditions in which people live. So research has shown that only 20% of health can be attributed to medical care, while social and economic factors like access to healthy food, housing status, educational attainment, and importantly, access to transportation account for 40%. These social determinants of health are the conditions in which people are born, grow, live, work, and age, and they directly or sometimes indirectly shape our health outcomes. So for our example, having access to transportation or having provider availability, all of these things impact health and health outcomes. So let's take a closer look at the role transportation plays in access to healthcare. Transportation connects people from their origins to their destinations, affect land use, it shapes our daily lives. Transportation is necessary to access our goods and services, activities such as emergency services, and healthcare. Because transportation touches so many aspects of a person's life, adequate and reliable transportation services are fundamental for healthy communities. In the United States, 3.6 million people do not obtain medical care due to transportation barriers. As I mentioned, rural populations, they're more likely to have to travel long distances to access healthcare services, particularly specialist services. We saw that play out in the example of the Vidant Pungo hospital closure. What I didn't show you in the map was that, yes, residents have to travel 23 miles to the next closest hospital, but if they want to receive specialized services, they may even have to travel further to the next closest regional hospital, which is 70 miles away. So here are some specific examples of transportation barriers that impact healthcare access. Transportation infrastructure. Rural roads are sometimes poorly maintained. They're often dangerous to traverse, so it makes travel difficult to healthcare. Transportation costs. Rural areas are often poorer than urban areas. So let's say there is a transit system there. Paying the fare could be a tremendous cost burden for rural residents. Also, there's personal cost to owning a vehicle. There's the cost of fuel, insurance, and that's why there's a large segment of the population in rural areas that don't have access to a personal vehicle just because it's expensive. Also, you have vehicle access, kind of going into this, the transportation costs, a lack of a personal vehicle, lack of access to a vehicle through friends or family. And then you have the distance and time burden, which I previously mentioned. People in rural areas, they live spread out. So trips actually take longer. And again, rural roads, they're often curvy, hilly. They can provide a challenge to maintain. So it complicates the logistics of transportation. And finally, you have policy. Rural transit agencies, frankly, often lack the financial resources to be able to provide the level of service that would make travel convenient for people. So all of these transportation barriers add up, and it does have a direct impact on people's ability to access healthcare. And as you can see here on the right, these things lead up to missed doctor and clinic appointments, limited pharmacy access, and decreased prescription fills. And it's an economic burden for patients and the healthcare system. So kind of to wrap things up and allow enough time for a discussion and for you all to ask questions, I kind of want to go over a couple innovative ways rural communities are trying to improve healthcare access. So in some communities where formal transportation services are not available or are insufficient, healthcare facilities or community organizations have chosen to fill this healthcare and transportation gap by doing a number of things, such as offering transportation services for healthcare appointments using paid or volunteer drivers, coordinating a shared ride cost transportation program. This is a good one, using telehealth to decrease the travel required for local patients to access specialty care. My mom actually participates in a telehealth program where she can sit in front of her computer, just like I'm doing with you all. Is virtual. She can speak to her doctor and go over concerns, so she doesn't actually have to travel to the clinic or the hospital. Some communities are starting a mobile clinic to take healthcare services to patients in remote areas. So there's a little bus that actually goes around and provides, certain basic healthcare services. Some services are actually also being provided at local schools, and that's so they can provide services to low income or high needs children. And then finally, communities are having community health workers or community paramedics visit people in their homes, which may decrease the frequency of trips of medical care. My father actually was sick a couple months ago, and there was a community health worker that would come in and take care of him. As I mentioned, my family lives in a very rural area, so that was a convenience for my father. So these are just some of the ways that communities are rallying together to try to provide some unique solutions. And as you can see, all of these solutions aren't necessarily transportation related. And finally, these are just a few examples, specific examples of some programs around the country that communities are looking at. For example, HealthTran, they are a non-emergency transportation service that offers rides for patients demonstrating a transportation need for timely, primary, and preventative care access in Missouri. You have Angel Flight West. They're a network of more than 1,400 pilots. This one I thought was interesting. They donate their skills, aircraft, and all costs associated with flying to help families and individuals in need in the 13 Western states. And then you have an example of the Tri-Valley Opportunity Council of Rural Transportation. They are a coordinated public transportation and volunteer driver system, which serves a rural 8-county area in Northwest Minnesota. So again, there are a lot of communities are not necessarily relying on their local transportation agency to fill these gaps. They're doing it, they're partnering with organizations to meet these needs. So that really, oops. Yeah, so that kind of concludes and wraps up what I wanted to talk to you all about today. I guess if I had to leave you all with a summary to wrap this all up, it's, you know, rural residents face unique challenges when it comes to healthcare access. Finding a feasible and cost-effective way to connect people to healthcare services is a goal for many policymakers and healthcare and transportation providers in rural communities. But, you know, the limited supply of rural healthcare services coupled with the growing trend of rural hospital closures is a reality in many rural communities. And for transit-dependent populations in these communities, the limited transportation options and the shrinking supply of healthcare services has made it difficult to access healthcare. So I would like to say that this has been a pleasure to present this topic to you all that's personal to me and to so many of rural Americans that often get left out of this conversation. And with any time left, I would love to open the floor for questions, or if there's parts of this you want to discuss, I'm open to that now.
Thank you, Ms. Crawford, for that really engaging and insightful presentation. Personally, as an aspiring medical student, I understand the need for providing healthcare to people in need at a limited time interval. So by presenting this, you're raising awareness to a really vital issue. And we should move on to our Q&A. If anyone has any questions, feel free to post it in the chat, or any points of discussion, feel free to go ahead. So I believe our first question will be from our press member, Umayma. Umayma, feel free to unmute yourself and ask the question.
Thank you. Thank you for your amazing presentation, by the way. It's such a big problem, like people can't, reach hospitals on time for their, appointments and everything. I have one question. What other problems do you think should be addressed urgently? A problem that rural communities also face, in your opinion?
That's a very good question. One of the biggest issues just in the United States is the issue of our land use policy. You know, we're a very auto-centric nation. So we often have a hard time here, especially in transportation planning, balancing, transportation, auto-centric transportation with the needs of people who don't, have access to a vehicle. So you have this movement in the United States called the Main Street movement, where they're actually trying to, even in rural areas, have it so a lot of the development is along the main street. That way people are more compact. And there's often been some opposition to this type of development because there's a certain character that rural communities have and want to maintain. You know, a lot of it can also be political. A lot of people in rural communities don't want that development. You know, they don't want to be a city. You know, they don't want that density. So there's that balance, that political balance there. Also, just in terms of healthcare and land use, there's been cases too, I didn't really bring this up, but where a hospital will close in an area and relocate further away. You know, and it's like, but your population center is somewhere else. So they're doing this because, you know, land is cheaper the further out it is. And there's really no coordination between the hospital, transportation planners, land use planners. So when they make this decision, oh, we're going to move this clinic or this hospital further out, there's no consultation really at the beginning with the transportation agency to say, hey, we want to move this hospital out. Can we, you know, can you have a route here? It's always an afterthought, you know, how are people going to get to these services? So I think that's one of the issues amongst many that rural communities are facing. Hope I answered your question.
Thank you very much. Thank you.
Thank you for your answer. So the next question is actually Rika's question, but Maybell added some things too. So these questions are: how do you make public transit more accessible and efficient so that private vehicles don't fill the road and cause as much traffic, especially when the government does not take this issue as a priority? And following to add this question, how do you make public transit more accessible and safer, especially during this pandemic, where being exposed in public is a huge risk?
Excellent, excellent questions. And so I believe, this is my personal philosophy, transportation is a political subject here in the United States, especially public transportation. Public transportation in the United States doesn't get the same funding that, you know, highways get. Just to give you all example, which this isn't really dealing with rural transportation, but I'm currently working on a project where it's a controversial project where they want to expand a highway. And a lot of people are against this, a lot of people in the community. And I live now in a very metropolitan area. I live in the Washington, D.C. area. And it's traffic, you know, a lot of traffic. So one of the states here, you know, really wants to push this highway plan. And you have a lot of public transportation advocates saying, you know, we should look at alternative modes of transportation. And it's become very controversial, especially the highways here in the United States have a legacy associated with them, where, you know, they've cut through communities, low-income communities, minority communities. So there's like all of these issues at play. And so it's really hard when you're dealing with the politics of transportation. It's really hard to think about, you know, how can we create this multimodal system that can connect people, because you have all these different elements at play. But I will say there's a smart growth movement happening here. And, you know, people are focusing on, you know, transit-oriented development where they're trying to develop close to existing public transportation. And these trends are also happening in rural areas where communities are looking to develop closer to transportation infrastructure. And I think in regards to public transportation in this pandemic, I think one of the things that this COVID-19 crisis has shown us is how important public transportation is. And maybe, this can be something that we use here in the United States to advocate for more public transportation, because what we saw is that the people who were still riding public transportation were the essential workers. They were the people, they were the nurses, they're the staff, so we saw that public transportation is actually a need. It's an essential need. So I think people are starting to wrap their heads around how essential public transportation is.
Thank you for that really descriptive answer. We have our next question from Ilse. I'm sorry if I mispronounce your name. And they say, how can I advocate for proper rural healthcare as a medical student in a developing country?
That's good. I've been reading a lot of cases of hospitals partnering with transit agencies. That is something that gets overlooked. But, well, at least here, I don't know the structure of, transportation agencies abroad, but here they have, a lot of these agencies have public meetings, they have boards. So a lot of times, hospital officials will go to these meetings. They will be a part of these boards. There's transportation advisory groups, and they will sit on these advisory groups, and they can be an advocate for their constituents, so their patients. So I think that is the number one way, is actually partnering and not being siloed, partnering to figure out, okay, what is the transportation needs of my patients or my constituents, and seeing what it is that we need and how we can partner with transportation agencies in providing transportation.
Yes, thank you for that answer. So since we have 3 minutes left, we will entertain one last question, I believe. The question will come from Latisha. In rural areas in developing countries, hospitals are much farther away, and even less people have cars. How would you compare the situation from the US to a developing country, for example, India, and how would you say the solutions transfer over?
Excellent question. I think that in the United States, we probably are in a better position in certain aspects. We may have limited transportation in certain communities, but we do have that infrastructure. We do have, public transportation. And so to compare the two, I think probably it would be unfair, given the resources that we do have in this country. But I think along the same lines, I think it does take for coordination of hospital administrations and transportation providers. It's going to take some type of coordination. But I do think that here in the United States, we probably don't have some of the same challenges, as far as infrastructure. Our infrastructure may be a little bit better than in rural parts of India. So, I don't want to compare the two. And one thing I wanted to say earlier in my presentation, even within the United States, rural areas are not all the same. There's different challenges. You have some rural areas that's on the the cusp of a suburban area, and then you have some that's really remote. So even within the United States, we're grappling with some of the same issues too. You have some places in the Appalachian area, which is a very, it's a mountainous area where it's extremely remote, and one of the things is bus operators talk about the problems of actually going up these mountains and, picking up people. So yes, all rural places, aren't the same, but I do think, it takes, as I mentioned, the coordination between hospitals and transportation, land use and planning. All of these things has to come together to try to provide some solutions.
Awesome, thank you, Latisha. When I worked with Latisha, I had to do some transit reviews in North Carolina, and one that really stuck out in my mind was in this area that she said, Appalachia. I believe it was Mitchell County.
Yes.
And this place, it was high up in the mountains, and it was so high where the office that I was working out of, we were above the clouds, and then there were clouds underneath me because of the mountains, and then you could see these different mountaintops with small communities, individual houses, etc. And these people would have to commute or travel very long distances to go for their regular medical treatment. And I thought that was really, really interesting. It's about time for us to wrap up. So I wanted to do this at the beginning, but I forgot. If you could you turn on your cameras so we could see everybody? If you feel comfortable. I always like seeing everybody because we come from all over the world. I'm just seeing Philippines, India, Norway, Maldives. I saw Ecuador, Qatar, USA,
Wow.
Canada, and I think we had another 15, 20 countries represented. Zimbabwe, welcome to the conversation. Thank you. And I think it's just interesting that we're discussing this transit issue because it's global, that we all can relate in some way to these issues. And thank you, Ms. Crawford. Thank you so much for joining us today.
No, thank you all. It was a pleasure. Thank you for having me.
All right, guys. So this is the last workshop session of the summit. I hope you enjoyed everything. We have one session left. It's our social hour. So if you signed up for that, please join in the next 15 minutes or so. And other than that, this workshop session is over. Thank you so much for joining.
Thank you.
Thank you, everybody. Have a great morning, afternoon, evening, night.
Bye, Augusta. Bye, Romer. Bye, Michelle.
Bye. Had a nice day. Thank you very much.
Bye-bye.
Bye.
Okay, I think that went well.
Yeah. All right. Thanks, guys. Thank you so much. I'll see you guys. Okay.
Thank you. See you.
All right. Bye-bye.
Bye.